This cookbook was one of our first fundraisers.
Dr. Lisa Tolnich's recipe for success started with a cookbook in 2005.
And we collected recipes from family and friends and patients and sold them for a really small amount to raise money for the foundation.
A cookbook filled with messages of hope, each recipe with a story.
Here, to me, each one I can remember well, not each one, but most of them I can remember the patient or the family member who did it.
From there, fundraisers for Pretty in Pink Foundation have grown to motorcycle rides, golf tournaments, softball games, fashion shows. The list goes on and on.
We started out kind of as a little mom and pop operation. We had one employee off a laptop and a phone and a post office drop box. And we were hoping to help 10 people a year in Wake County. So every year it gets to be more and more and more. I think the need keeps going up as well. I didn't know if we'd make it back at the beginning, but here we are.
The beginning started around the kitchen table where the idea for Pretty in Pink Foundation was born.
I had a couple of patients who had a biopsy that was abnormal, who didn't pursue care because of money. And a long time ago, I could talk to the hospital administrators and say, I have this patient who doesn't have anything, can you help me out? And they used to be able to do that. As money got tighter in medicine, that was no longer a possibility. Back then, too, if you were diagnosed with cancer or another bad diagnosis, lots of times you would lose your insurance. One of the management consultant people that I knew back then, Mark Weiner, and I were sitting around the kitchen and talking about how we could start something that we could help people with a diagnosis, and then we thought about using it as a platform for other diseases. And that's how we started with breast cancer, because that's what I did.
While starting the foundation was difficult, Dr. Tolnitch attributes the success of the nonprofit to staying true to the mission, providing uninsured and underinsured breast cancer patients in North Carolina with financial assistance for quality, life-saving medical treatment.
It was pretty hard. As I said, most everybody at the beginning did it as a personal favor to me.
Yeah.
I think still a lot of people are doing it as a personal favor to me. Maybe I've helped them or somebody in their family. But we had a lot of bumps and along the way. It's much smoother now. We're way more organized. We're way bigger. And we focused, I think the mission has been clear from the beginning.
A clear mission and a love for helping others, which is literally in her blood. Dr. Tolnitch is a descendant of Clara Barton, an American nurse who founded the American Red Cross. Her great-uncle, who was in the medical field, was also a big influence when she was younger.
He was in World War II as a field surgeon, what we would now think of as a MASH surgeon. He was a very big figure in my life when I was young. And so I thought about medicine. I wasn't sure about surgery until I was into it.
Dr. Tolnitch received her medical degree from the University of Louisville School of Medicine, then completed her internship and residency at the University of North Carolina. She was just the third female surgeon in the state when she began her practice, Tolnitch Surgical Associates. And she certainly left her mark in North Carolina, performing the first lumpectomy in Wake County in 1988. And over the past 30-plus years, she's helped countless people as a world-class breast cancer surgeon.
When I was younger, people used to ask me, how many have you done this or that? Nobody asks me that anymore. But I'm sure it's thousands of people.
And she's helped just as many people outside of the operating room. Our champions.
I wasn't sure how it was going to work out, but I'm really proud of it. I'm proud of where we are right now.
A life-saving vision brought to life with endless stories of inspiration.